Assalamu alaikum everyone, this is Amna Roshan Khan from BBA 2A of JUW University for Women. So the topic about which I am going to talk today is the wrong injection cases. First of all, I would like to start my very first case that was happened in Mansehra, that is Rehana Sultan case. In November 2019, Rehana Sultan along with her brother went to Jinnah International Hospital, Ahmedabad for treatment of cough where the patient died shortly after due to wrong injection. According to details, the patient's brother said that his sister was taken to the hospital for treatment of a mild cough. The doctor admitted the patient for 7 days after examining her, but on the morning of November 20, after breakfast, a staff nurse gave him the wrong injection to the patient without the doctor's prescription, which made the patient's condition critical, and due to this negligence of nurse, the patient died. The second case was Noor Sabha case in Karachi. The 8-year-old girl Sabha Noor was brought to a clinic in Gulshan Iqbal, Tera D area by her parents after she complained of cough and flu. She was administered an injection by a man claiming to be a doctor. Immediately after the injection, her condition deteriorated and she passed away. Her father, Zafar Iqbal, said his daughter was checked by the quack and then given an injection, after which her mouth started foaming. Seeing her condition, the doctor named Adnan told us to rush to another hospital, but she died before that. The another case in Karachi was Nishwa case. A minor girl, Nishwa, on 15th April, who was administered a wrong injection at Darul Sehat Hospital, has passed away. According to details, Nishwa was under treatment at Liaquat National Hospital. The doctor said that the girl died few hours ago. The another case happened in Gujranwala, that was Haris case. A 40-year-old man, Haris, who was suffering from fever, he went to a private clinic which was run by a doctor. After examining the patient, the doctor administered an injection to him. However, after a few minutes, Haris' condition deteriorated and he passed away. The another case happened in Rahim Yar Khan, that was Ali Murtaza case. Similar, a few days back, a 2-year-old Ali Murtaza died after being given the wrong injection at a private hospital. His father Abdul Ghafoor said that he brought his son to doctor with minor pain. After waiting for a while, the doctor examined his son and asked a paramedic to administer an injection. Ghafoor pointed out that they asked the doctor not to give an injection as the boy was not seriously ill and on an empty stomach. So the question comes is, why wrong injections situations is created? As many cases have been done in different public and private hospitals. Some are reported, but unfortunately, most of the cases are not reported. The main reason behind all these cases was an injection called Transamin, which is being used to control bleeding. What actually happens is that doctors prescribe injection Transamin in their broken handwriting, but a semi-illiterate person at the medical store gives injection Tracerium, and again a semi-illiterate staff nurse in the ward without cross-checking injects this injection to the patients, and ultimate results is the death. Injection tracerium is a drug used by the anesthetist to paralyze all the muscles of the body during the surgery. What administrations should take steps for these types of cases? Incidents like this are more common these days as Pakistan Medical and Dental Council is failing to regulate the private clinics. Strict punishments for the negligent doctors can reduce the number of such abhorrent incidents, and the regulatory authorities need to keep a close eye on the defaulters. No staff nurse in any case be allowed to inject any injection to the patient. It should be the responsibility, morally and legally, of the doctor on the duty to give all the injectable drugs to the patient in his or her supervision. These specific drugs should never be available in the ward. Doctors should be careful in prescribing injections, but if at all it is necessary to prescribe this injection, then there should be a clear-cut instructions to be injected by the doctor on the duty.